I'm Dr. Meena Rafiq. I'm a GP and a researcher at UCL specialising in sarcoma, and today I'm talking about how we can recognise sarcoma earlier in primary care. 40% of patients who are diagnosed with sarcoma will die within 5 years of their diagnosis, and diagnosing sarcoma is really challenging as it's rare, it often presents in young patients, and its symptoms can often be mistaken with other conditions like lipomas or cysts, so it can be hard to diagnose. But recognising sarcoma earlier in general practice is really important. For every 1 centimetre that a sarcoma increases in size, there's an increased risk of complications, amputations and death. So it's really important to patients to pick patients with sarcoma up earlier. Diagnosing sarcoma can be really challenging, and we've got some top tips to help you pick up sarcoma earlier. So in patients who have a soft tissue lump, you should always have sarcoma on your radar. So when should you be thinking about sarcoma? In any patients who consults you with a soft tissue lump, you should be thinking about sarcoma, particularly if it's over 5 centimetres, if it's persisting for more than 2 weeks, if it's firm or fixed, or if it's rapidly growing. I saw a patient with sarcoma who saw a previous GP and they had a lump and they were referred for an ultrasound scan, but there were delays in getting that ultrasound scan. And then they came to see me while they were waiting for the scan, and their lump had grown, and when I felt it, it was fixed and it was firm and it just didn't feel right. You don't have to be certain it's a sarcoma, but if it doesn't feel right, just get an imaging done or get a referral done. And if you're unsure, you can always contact the specialists in the hospitals, or you can look on Sarcoma UK's website, which has a host of resources, and they also have a helpline that you can call if you want to talk about a case. Bone pain is another symptom of sarcoma that we should be thinking about. And the patients that you should be worried about are patients who have bone pain that have it at rest, at night, that have it when there hasn't been any trauma, or if it's persisting for more than 2 weeks. As GPs, we can normally get urgent x-rays readily available, so if you see a patient with any of those symptoms, just request an x-ray to make sure it's not a sarcoma. And the take-home message is, imaging is really important, so if you think that it might be sarcoma, if it doesn't feel right, anything like that, in a patient with a soft tissue lump or bone pain, then get some imaging done or do a referral. And there's lots of resources available on the Sarcoma UK website.